afternoon and welcome to the Mayo Clinic Health System Albert Lea and Austin Milestone celebration. What a beautiful day. We are celebrating the completion of construction and much awaited opening of our final phases, the medical, surgical, and the family birth center unit. We are starting our celebration with a ribbon tying ceremony hosted by Albert Lea and Austin Chamber Executive Director and President Sherry Jensen and Elaine Hansen, as well as representation from our chamber ambassadors. A ribbon cutting ceremony traditionally designates and celebrates building or event opening. Through our ribbon tying event, we are celebrating bringing our communities together with high quality medical services. The purpose of our ribbon tying is to connect our patients, staff, community partners, and local businesses, and all members of the Albert Lea and Austin communities. I'm going to turn over to Elaine Hansen, President of the Austin Chamber, for some comments.
Thank you very much, Chris, and thank you, Dr. Shoddy, for allowing us to be a part of this special day. It's really wonderful to see Mayo's contributions to our community to ensure that ongoing excellent health care that we all deserve and appreciate, as well as your corporate citizenship here in our community. We appreciate your many years of dedication and service to help ensure that we are all living a good, healthy, and safe life. So thank you and congratulations on this wonderful day.
And to Sherry from the Albert Lea Chamber.
Thank you. I just want to say thank you to Mayo for inviting us to be part of this milestone and celebratory occasion. We're really appreciative of our partnership with them. And we're appreciative of our partnership with them and for all that they do for the community, and also to have such wonderful programs and services so easily accessible to our community. Thank you again for inviting us to be a part of it.
All right, thank you all for being here. This concludes our ribbon tying ceremony, and we will, for those of you that are watching online, we'll be transitioning to the rest of our program. In the interim, there will be some footage of our new area, and we welcome you to stay around and watch that footage in the transition. Thank you.
Good afternoon, everybody. I hope you can hear me okay. You can move in a little bit. You don't have to stand way out. There's plenty of room up front here. Welcome to our celebration today. We will ask everyone to keep their masks on. The speakers are going to unmask. We've all been vaccinated. And so if you can just keep your mask on, that would be great. It's a great day for us to celebrate here today. We certainly appreciate all the organizations that are represented here today and all the elected officials that are here in person. We're grateful for all of you for helping us celebrate today. And we're going to start with a video from Dr. Firouzja. Dr. Firouzja could not be here today, and so we can roll that video.
Good afternoon, everybody. It's a great day to celebrate Albert Lea and Austin's accomplishments as you've worked together over the past 4 years to keep a full range of healthcare services close to home for our patients as you transform community care. Thank you. Early on, you saw the importance of keeping the routine surgeries and procedures that patients need most in both Austin and Albert Lea. But you also recognized the need to combine hospital services in one location to fully staff those units 24/7 and maintain quality. These changes will certainly improve care for our patients, but as you well know, they came with challenges about where people work and receive care. Together, all of you, our staff, our patients, and our community members have overcome each challenge to bring us to this day of celebration. Today, Mayo Clinic Health System in Albert Lea and Austin stands as an example of innovation in community care and an example of our commitment to present and future generations of patients in southeastern Minnesota. We'll continue to make community care effective, accessible, and convenient. And we'll use all the tools and technologies at our disposal to help patients, whether they live in rural Minnesota or a continent away. Mayo Clinic is leading the digital transformation of healthcare, and that includes combining and seamlessly transitioning between in-person care and virtual care to meet each person's individual needs. Mayo Clinic Health System in Austin and Albert Lea have made great strides along this continuum with the addition of these excellent new facilities to support our patients and staff. Congratulations and thank you.
Thank you, Dr. Firouzja. We're also honored to have with us today Mary Jo Williamson. Mary Jo is the Vice Chair of Administration for Mayo Clinic, and she's also the Chief Administrative Officer for Mayo Clinic Health System. She's been a really strong advocate for Albert Lea and Austin, and we're welcoming her today. Thank you, Mary Jo.
Well, it's such a great day today, and I'm just so pleased to be here. Thanks so much, Dr. Shoddy, for inviting us and for making this all possible. I think this day has been a long time coming, and I couldn't be more excited about hearing the enthusiasm, the pride, and the excitement in all of our team's voices today. On behalf of Mayo Clinic Health System, I really want to say congratulations on navigating through this very complex, but what will be a very high-impact project. Thank you for everyone involved in enhancing our facilities and really setting the stage for how care can be delivered for decades to come. All you have to do is look at the faces of our teams to know how much it's appreciated and what good use they will make of it. I want to give a special shout out and thanks to my former partner in crime, Dr. Bobby Gostout, who was the president and CEO of Mayo Clinic Health System until she retired in December of 2020. Bobby, I'll just say on behalf of all of us, we could not have done this without your passion, your commitment, your vision, your drive. It's just great to have you here today, and I want to personally thank you. I have to tell you, when Bobby's involved, anything is possible, and I think we have so many examples of that, and it's great to have the chance to share it with her today. It really has been so exciting, and I hope many of you have gotten a chance to take a look at some of the new facility and these new and beautiful renovated units. We spent the morning in Albert Lea and the afternoon here. But as I said before, what really makes the magic happen is the teams behind it, and to see their drive to deliver the best on behalf of our patients is just so heartening. I was just thrilled to be part of it, to get to meet them and get to see how they will make this place such a landmark and important for our communities. We all know healthcare is changing so much. If anything we've learned over the past 18 months is that we can't stand still. We're really thrilled to see the pandemic start to come into some of its final phases, And so many of our communities were hard hit. But by working together, I think we really were able to deliver the best care possible in challenging times. And I really want to make you assured that we've taken the lessons that we learned, which were many, about how to empower teams, how to be nimble, how to inspire leadership, to really deliver the best in good times and in bad times. We're taking those lessons learned and figuring out how to build upon them. And I'm sure it's not lost on any of you how we quickly transferred in-person care to digital care and then brought some of it back. And we're looking to really refine and innovate off of those lessons learned. And if you had a chance to see the mobile unit, that's just one of many examples that you'll be seeing coming. But really, the opportunities are endless with these new care models. And as you heard Dr. Ferrugia say, we're absolutely committed to being a leader in digital health. And the health system is such a great spot to innovate, learn, and adjust from that we're looking forward to walking that journey with you. As patients' expectations really continue to evolve, I want to assure you we're not just riding that wave. With our 150-year history and with our strong bonds across our sites, we're looking to lead the way. We want to do that in conjunction with our staff and our communities. To really find the best ways to work together to deliver that highest quality care possible to patients near their home. So from the smallest clinics to some of our largest hospitals, we cover a lot of different geography, a lot of different types of organizations. We are really determined to continue to invest in our people, who, as you all know, are the heart of Mayo Clinic. It's where the magic happens. And to invest in our facilities to ensure that we can deliver best-in-class care. Our Austin and Albert Lea medical centers are such an important part of this transformation that we're driving. I'm just so glad to be here today to congratulate the staff and to thank you, all of you, for your part in making this happen. So thanks so much.
Thank you, Mary Jo. And now we'd like to show you two of the units that we've finished, which is the medical surgical unit and the ICU. And we're using those units, so obviously in-person tours are not available, so we will show you a short video.
Welcome to the Medical and Surgical Unit at Mayo Clinic Health System in Albert Lea and Austin, located on our Austin campus. Thank you for choosing our hospital to receive your medical care. At Mayo Clinic Health System, we look forward to providing you the highest quality medical care close to home. We have a total of 39 spacious rooms in our medical and surgical unit. Each room is thoughtfully designed with the highest safety standards in mind. Mayo Clinic Health System has invested in the latest technology and equipment to ensure your stay with us is as comfortable as possible. Large, private bathrooms in each room feature walk-in showers. These very spacious rooms also feature the latest in telehealth technology, ensuring easy access for consultations with Mayo Clinic experts. For patients needing more advanced care during their stay, our 12-bed intensive care unit is located just one floor above the medical surgical unit. Each room features ample and comfortable seating, along with easily accessible telehealth technology which, if needed, can provide immediate access to medical experts at the world-renowned Mayo Clinic in Rochester, Minnesota. In each room, there are electric patient lifts, allowing staff to easily and safely transport or reposition patients, greatly reducing the risk of falls or other injuries. Back on the medical surgical unit, for those undergoing physical therapy as part of their recovery process, there is a dedicated gym located close to patient rooms. At Mayo Clinic Health System, you can rest assured our highly trained and caring staff is available around the clock to meet your needs, including our nurses stations on the unit, just steps away from your room. For our visitors, there is a large, modern, and comfortable waiting area with a flat screen TV, abundant natural lighting, and even a cozy fireplace. A convenient skyway connects the waiting area to the elevators at the hospital's main entrance. The Medical Surgical Department at Mayo Clinic Health System, Albert Lea and Austin is located at 1000 First Drive Northwest in Austin, Minnesota. Conveniently located off Interstate 90, south of the 178A exit. At Mayo Clinic Health System, the needs of the patient always come first. We look forward to having the privilege of caring for you. To learn more, please visit mayoclinichealthsystem.org.
Now I'd like to introduce Dr. Bob Albright. Dr. Albright is our Regional Vice President for Southeast Minnesota portion of Mayo Clinic, which is what Albert Lea and Austin are part of, and we're very pleased that you could be here today, Bob.
Thanks, Mark. First off, thanks everybody for being here. It is just a wonderful day to see everybody shining and great faces to be here and appreciate this marvelous event. Today, I wanted to take just a few moments to highlight the region and the interaction with all of our patients and all the other staffs around the region. But first, I'd like to spend just a moment or two thanking Dr. Shoddy and the leadership team, both here and in Rochester, for getting us where we are today. It's been incredible work to get us here. It takes a village, as we all know, to make these sorts of things come together. And truly, we've connected 2 villages today to bring us to our 1 hospital and 2 campuses. Now, we all work as part of a team, no matter what line of work you're in or your family or whatever you do in your work life. But I wanted to highlight my partners in my work life. And I would also like to say a shout out again to Dr. Bobby Gastal, who is very gracious to take some time away from her retirement and be here with us today. Again, thanks, Bobby, for being here. I wanted to appreciate my partners in our leadership team. And first off, I would like to appreciate Dr. Jennifer Horn. She's our region's clinical practice committee lead and a family medicine physician. All of us have day jobs, by the way. Dr. Horn is a family medicine doctor, and she's cared for our loved ones right here in this facility. Highlight Mr. Eric Crockett. He's our division's regional administrator. Been part of the renovations and the integration all along the way. Just an outstanding partner who keeps me safe when I start getting expansive about spending lots and lots of money. Dr. Charity Cognata-Ricky, she has her doctor and nurse practitioner, and she's our regional nursing lead and nurse administrator. She is a gem, and she walks the talk. She's always out here with our population. So we're here today to celebrate this wonderful facility, which is definitely worth celebrating, but the facility is just a small part of the picture. It's really, as MJ points out, about the people that work here. And just as a little anecdote, you know, we've been through this little thing called a COVID pandemic. And part of the COVID pandemic taught us how we could transition our care, how we could be leaders in a space of technology, how we could be leaders on the tip of the spear, so to speak, with new antibody therapies and how we take care of our patients and get them vaccinated. And what we really found with our team's engagement was that we needed more staff. At the time of the COVID pandemic, we had hundreds of our staff out. Had we not pursued this integrated approach to healthcare, I think we would have struggled with staffing these institutions. That was a true proof of the wisdom of the leadership at the time. And I highlight our nurses because most of our staff that came back to help work during that time were folks that had retired. And they came back to work to vaccinate our patients, to do testing, to do our antibody infusions. Truly a remarkable testimony to the teams. And again, although we're celebrating the facilities, we really are celebrating our staff today. So thanks for that. Finally, we're wrapping things up today for another transition, not only our transition to our staffing, but also that we are celebrating that Dr. Shoddy is transitioning and rotating from his leadership position. So for 25 years, Dr. Shoddy has supported our staff, our patients, our families, and our loved ones. He's been a steadfast, stalwart person that fostered everything that's right about medicine and medical care. Thank you for that. You've truly been a servant leadership. Dr. Shoddy has always walked the talk, and we'll see in just a few moments here what some of his underpinnings of his pillars of how he fosters our staff. And at Mayo Clinic, we rely on 3 pillars, and I think we'll also see some of the 3 pillars in just a moment that Dr. Shoddy appreciates. So I think I'll turn the podium over to Dr. Shoddy to finish us up here today. Now, sometimes when famous people are done, they do a mic drop. I don't think you should do that. I've been told we're not allowed to do that, so don't do that, Mark. But again, my appreciation to Mark and this marvelous team here. Thank you so much, Mark.
Thank you, Dr. Albright, for those kind words. Could I have my leadership team up here, Chris and Sumit, Melissa, Lori, Trisha? 4 years ago, this team was given the task of transforming our 2 campuses to create a first-class, sustainable model of rural healthcare. And as you know, the journey has not been without obstacles. This team, however, kept a laser focus on our goal, which was do what's best for our local patients while leveraging our role as part of Mayo Clinic, the world's greatest healthcare organization. And for those of you that don't know what all the projects were in this journey, they're listed on this slide here. All of these areas have state-of-the-art design, technology, and construction that are focused on the comfort and safety of our staff. And as has happened frequently during my career, I've been asked to make a comment about a project, and also, which has happened frequently, I did actually very little of the actual work. We've had literally hundreds of individuals as part of the various work groups, and each group had a leader, such as our current Chief of Staff and former Chiefs of Staff, Dr. Heidi Gaston, Dr. Jennifer Goins, and Dr. Shara Sherger, who are all here today, leading the Family Birth Center group. Thank you to them. And over a 4-year period, we've had many colleagues that were involved that either came and went because of retirement, relocation, or reassignment. There's simply not enough time to mention all the groups and individuals. However, I think the leadership team beside me here really should be recognized because they've been a leading force to the various aspects of this project. So I'd like to introduce Chris Johnson, my administrative partner. About 4.5 years ago, Chris was still working in Rochester, and she wanted a little more excitement in her assignment. She joined us 4 weeks and a year ago, or 4 years and a week ago, right before the announcement, so she certainly got her wish. She's been a valuable partner and a friend, and I've enjoyed learning from her. And then we have Lori Routh, who's our Chief Nursing Officer. As you can imagine, a project like this is instrumental and heavily involved in nursing. And Lori's done a great job of keeping the nursing staff engaged and informed. I know that she has the respect of all the nurses, so thank you, Lori. Trisha Dahl, who is our Albert Lea and Austin Operations Manager. This project has really consumed Trisha's life the past 4 years. And as I've mentioned, there have been some significant community issues, especially over in Albert Lea. Trisha, under very difficult circumstances, remained a visible, active community face and voice for Mayo, advocating for this project, advocating for Mayo, and advocating for our patients. So thank you, Trisha. And Melissa Barr, an operations administrator, she's been part of the project the whole time. She is the administration manager for the new psychiatric unit in Albert Lea. She's been involved in many other aspects of the project, always willing to help, always organized, and not afraid to offer me a counter opinion. Anytime that she's asked to do something, it just simply gets done. So thank you. And then Dr. Bagra, Sumit. Sumit's our medical director, and he and I work closely daily. He's been a voice for our medical staff and our patients throughout the project. He's wonderful to work with and has the respect of the team. I've been away from the practice and administration quite a bit the past few months with a medical issue, and Sumit stepped right in and took over my role, including his own role, all at the same time. And so Sumit, a special thank you to you. And you're welcome to go somewhere more comfortable. And as they find somewhere more comfortable, I'd also like to recognize the unit managers that were involved with transitioning the units, which is a tremendous amount of work, and you can see them listed on this slide. I'd also like to thank Cheryl Ellingson, who's my administrative assistant. She organized and scheduled and took minutes for the literally hundreds of meetings that this project required, and she kept us on track. She also organized today's celebratory events for the staff on both campuses, so thank you, Cheryl. And then Theresa Anderson, is Theresa here? Hi, Theresa. Theresa is what you would know as our construction manager. She's been responsible for managing the trades, coordinating the construction, and timing the transitions and moves of the various units, all while we had to remain open to see patients. And despite several construction surprises, bad weather, and oh yes, a pandemic, this project is on time and on budget. On time and on budget, a $25 million project, and that credit goes to Theresa. Thank you, Theresa. And also, thank you. Also, a heartfelt thank to our Albert Lea and Austin local board members for their counsel and support. You have stood with us through this entire project, keeping us connected with the community and making sure that the voice of the community was heard. And I'd also like a special thank you to our spouses and families who have been on this journey with us. I know many nights and weekends we brought our work home with us, and during the pandemic, we actually worked from home, subjecting you to watching us do endless Zoom meetings. So thank you for your patience and support. And to my wife, Allison, who's up here with us as well, a special note of thanks to you. You know, Allison doesn't want anything to do with my work, and she certainly doesn't want anything or didn't want anything to do with this project. However, that's not how fate would have it. And so whether it was at a restaurant, at church, at the grocery, or anywhere that we went, she handled the comments and questions with the grace and poise that she always does. So thank you, Allison. And my biggest thank you and gratitude goes to our entire staff. We asked our staff to continue to deliver high-quality, compassionate care while working in a construction zone, while moving whole units and services, while dealing with some community issues, and during a pandemic. And the staff did just that. They remain focused on the reason that we all get up each day, which is to take great care of our patients. It's our staff and the way that we do things that sets us apart. And so again, to all of our staff, all of our employees, on behalf of this team, Rochester leadership, the board, and our patients, thank you, thank you, thank you. And I'd like to, yes, applause for the staff, absolutely. And I'd like to take off my healthcare hat for a minute and talk to you as a father, as a husband, and a grandfather, as I think about the Family Birth Center and the med-surg floor right below us here. I realize that some of the big points in the circle of life occur on those two floors, and they really occur within several feet of each other. In this Family Birth Center, new life begins. Think of the magnitude and wonderment of that. It's not a delivery, it's a new life. And at that instant, the birth occurs. Think of the faith, hope, and love that are present and fill the hearts of those involved. And just a floor below, not too many feet below, we have friends and family, and again, not inpatients or the hip fracture in room 33, but loved ones fighting an illness or an injury, trying to return to their normal life. Almost all will win that fight, and what a blessing that is for those families. Again, stop and relish the faith, the hope, and the love necessary to overcome illness. And unfortunately, the end of life also occurs here, within several feet of those other two milestones. Sometimes it's expected and sometimes it's not. Death is another part of life that will come to all of us, another significant occurrence for the patient and the family, and another time when faith, hope, and love need to be present and comforting. All of those parts of the circle of life happen right here. All of them deserve respect and dignity and compassion. We are privileged as healthcare workers to be present and available and compassionate for those moments in a family's life. Now we can do so, and the patients can experience these life events in a facility worthy of those events. The photo here is a piece of original artwork that my wife Allison and I have commissioned for this space right here in honor of our children and grandchildren. As with many things, the pandemic has delayed its arrival. It is three 3D columns of artistic blue glass with one column representing faith, one hope, and one love. A small plaque will describe it as you can see here. It's a reflection of my family's, my family's deep religious foundation. However, faith, hope, and love are universal principles present in all faiths and all religions. It also honors these three timeless values, faith, hope, and love, that guide our profession. And so today we dedicate these new facilities to the faith that we can continue to treat and beat illness, to the hope that new life brings to all of us, and to the love that we can all share as one. And now we'd like to give you a video tour of the Family Birth Center.
Welcome to the Family Birth Center at Mayo Clinic Health System in Albert Lea and Austin, located on our Austin, Minnesota campus. We'd like to show you how our hospital offers a premier birth experience in the Albert Lea, Austin, and surrounding area. We know you want and deserve the most advanced medical care and amenities available during this special time in your life. We have a total of 10 rooms in our birth center on the 3rd floor of the hospital.
The new rooms were great. We felt like we were walking into a hotel. The rooms were spacious, they were clean, which helped me feel comfortable throughout my labor, delivery, and postpartum stay.
The spacious private rooms provide a calm and serene environment. These rooms were thoughtfully designed with you and your family's comfort and safety in mind. Medical equipment is discreetly stored behind cabinets and available in a moment's notice. Spacious rooms allow patients to remain in the same room throughout labor, delivery, and postpartum care. There is ample and comfortable seating for visitors with couches and a gliding chair, along with cable TV, Wi-Fi, and even a refrigerator, all to best meet your needs. Birth center rooms feature amenities like this beautiful bathroom with a full shower and soothing heated tub for mothers to relax. At Mayo Clinic Health System, our highly skilled medical professionals are available 24/7, 365 days a year.
I'm glad I made the choice to deliver at the Family Birth Center because of the great staff support.
An obstetrics operating room dedicated to cesarean section deliveries and other emergent labor and delivery procedures is located within the Family Birth Center unit, ensuring quick access just down the hall from your room. The nursery and procedure room allows for newborn advanced care, including telehealth technology, allowing immediate access to expert neonatologists at the world-renowned Mayo Clinic in Rochester, Minnesota. The large room has enough space to easily accommodate all needed staff and equipment.
The experience was really good. Both the physician and nursing team made us feel safe and well taken care of, the best in the country.
We know our staff makes all the difference in your birth experience, and the highly experienced and caring nursing team with years of delivering babies in the Albert Lea, Austin area is always close by whenever you need them, as the nurses' station is centrally located on the unit and also overlooks the nursery. Last but certainly not least, we haven't forgotten the other special people in your life. For our visitors to the birth center, there is a large, comfortable waiting area that even includes a special place for our youngest guests to be engaged and entertained. The Family Birth Center also features special security measures to provide peace of mind during your entire stay. The Family Birth Center at Mayo Clinic Health System, Albert Lea and Austin is located at 1000 First Drive Northwest in Austin, conveniently located off Interstate 90 south of the 178A exit. To learn more about the Mayo Clinic Health System Family Birth Center in Austin, please call 507-509-5464. We look forward to the privilege of caring for you and your baby.
So thank you so much for attending today. It's really been our privilege to share the hard work of the teams and our new facilities, so you can see where we're going to take care of our families and friends from both Albert Lea and Austin. We appreciate your attendance. There's a small token of our appreciation for your part of the journey on a back table there as you leave, and this will conclude our program. Thanks and have a great evening.